It's right at 2 o'clock, so we'll go ahead and get started. Well, I just want to thank everyone for joining. Hello, and welcome to Transforming Built Environments at the 17th edition of the International Conference on Urban Health, hosted by the International Society for Urban Health in partnership with Salerbal and PAHO. I'd like to extend a special thank you to this year's conference sponsors, the Novartis Foundation, Novo Nordisk, and the Botner Foundation, who supported us in making this event possible despite the many challenges of convening this year. I'm Giselle Sebag, and I'm delighted to be here today, not only as the incoming International Society for Urban Health Executive Director, but also because I firmly believe that turning evidence into action to transform urban environments offers unparalleled opportunities to improve health equity, and environmental sustainability for urban residents, regardless of background, age, economic means, or even zip code. At the International Society for Urban Health, we recognize the complex and interconnected challenges and opportunities that cities present, as they are uniquely positioned to either enable or hinder health, quality of life, wellness, and equity. But we also understand that knowledge, policy, and practice must be aligned in their objectives if they are to promote better health outcomes. ISUH is therefore dedicated to improving health and health equity in cities worldwide across multiple disciplines and sectors, with the goal of creating a better future for the greatest number of people. Hence our focus on urban environments, both large, small, and growing. Our recently updated strategic plan calls for aggressively expanding our network to reach even more mayors, policymakers, grassroots civil society organizations, local leaders, NGOs, and urban practitioners such as architects, urban planners, and engineers. Because as has been further highlighted by the pandemic, often the decisions that make some of the biggest impacts on health end up coming from non-health actors. And the truth is that everyone working in cities today is a public health professional, charged with either promoting improved mental, physical, and social health through the decisions that they make, or unfortunately, sometimes hurting it and perpetuating existing systemic health inequalities. That's a really big responsibility, but it's a choice that we all can make. And our hope at ISUH is that by bringing even more built environment stakeholders into the conversation and equipping them with evidence-based tools to take action to improve health, we'll all be able to recognize the critical role we play in shaping health in our communities. And so to that end, we have an absolutely incredible and very impressive lineup of experts today that are here to discuss the impact of urban environments on health and to present practical examples of successful multisectoral strategies to redesign and transform cities in ways that promote health equity, and environmental sustainability for all residents. We'll hear from each of them, and then we'll have time for a good, robust discussion at the end. And like all of our plenaries in this conference, this event is being recorded in both English and in Spanish, and will be available to everyone afterwards for participant viewing. I want to invite you to utilize the Q&A function during the presentations, and afterwards we'll get to as many questions as possible in the discussion. And so with that, I'm delighted to first pass it over to Dr. Daniel Rodriguez. Dr. Rodriguez is Chancellor's Professor in the Department of City and Regional Planning and Associate Director of the Institute for Transportation Studies at the University of California in Berkeley. He is the co-PI of the Urban Health in Latin America Salerbal project, and his research focuses on the reciprocal relationship between the built environment and transportation and its effects on the environment and health. So with that, over to you, Daniel. The floor is yours.
Thank you very much, Giselle. Let me share my screen and we get going. Hello, everyone. It is a pleasure to be here today as part of this plenary session. My thank you to the organizers and the sponsors, and to Giselle for your excellent introduction. Today, I'll speak about the emerging challenges and opportunities of transportation systems for cities of the future. And I want to begin with a simple reflection, often lost on my fellow transportation planners and transportation engineers. We move because we want to get to places. In those places, we want or need to engage in certain activities: work, recreation, socializing, school, perhaps health services. Those activities are likely to increase our well-being, maybe material and mental well-being. Yet movement has friction. It takes time, it takes energy, and it may have an unintended impact on users and on others. Think about emissions, or think about road collisions. Most of us would like to use travel modes that have less friction, maybe because they cost a little less, they have fewer impacts, maybe they're a little faster. And I bring this up because we are at the doorstep of dramatic changes in how we move around cities. Transportation innovations are being developed, tested, and implemented that are having significant impacts on cities, some of which can directly affect health and health equity. And as such, we need to mobilize the research and the policy community working on urban health to consider these issues, to contribute research, to mobilize those other sectors, the transportation planners, the land use planners, the education sector, and to guide policy making so as to improve health and health equity. In my next few slides, as a preamble, I will provide some background on past transportation technological innovations and mobility, linking it to current challenges, especially on active transportation. Then I will discuss emerging innovations and what they might mean for urban health and health equity, including opportunities for research. On the left side of this slide, you'll see a bunch of transportation technology innovations emerging in a few minutes. Some will make it to market and some won't. Some have had short-term impact, some have had durable impact. Some were too early for their time only to be reconsidered centuries later. These have significant impacts on health and sometimes are even propelled by concerns about health. The successful technologies come to market and we use them as individuals. On the right-hand side of the slide are the technologies that we consume to negotiate space. It's our mobility. The point that I want to make to begin is that technologies are only successful insofar as they are adopted and used. And therein lies the innovation part of technology. Consider the horse-drawn carriage, a technology that impacted our cities greatly, making the footprint of large cities grow by 2- or 3-fold. Or the first automobile, an electric vehicle boasting no less than 100-mile range. The bicycle and its enormous role in the voting rights movement in the US. The pneumatic subway, the 19th century prelude to what Elon Musk now calls the Hyperloop. Sidewalks are transportation infrastructure as a way to protect pedestrians from the ensuing chaos of multiple modes of transportation. And then these rail-like looking buses with articulated bodies, a hybrid between a caterpillar and a futuristic looking bus. So we have this wonderfully rich history of transportation innovation, some of which have been more or less successful. And that brings us to the conditions of the early 21st century. Unfortunately, currently in most countries and cities around the world, we have a motorization pattern that follows this S-shaped curve with changes in per capita income on the x-axis and the motorization rate on the y-axis. At first, at the left-hand side of the curve, at lower incomes, the increase in motorization is slow, but then the increase is quite fast. This is where it rises the steepest. And then the increase slows down, with motorization rates going up, but at a decreasing rate. This curve, or these three curves, are for 4 countries of Latin America. There's some variation, as you can see. There's some out-of-range extrapolation involved. But the trends should be of concern for cities in Africa, cities in Asia, where they're late urbanizers and motorization rates are much lower right now. This curve has been given an aura of inevitability. Many of you might remember growing up and desiring a motorized vehicle, maybe a motorcycle, or you could afford it, a modest vehicle, modest car. Your transportation technology exposure began with walking, bicycles perhaps, maybe public transportation, and may have rapidly devolved into private modes of transportation. But I want to highlight 2 important aspects here. First, this trend is not inevitable. As income grows, motorization does not need to happen, and some cities worldwide have been much better at leveling the playing field by increasing the friction of automobiles and by making other modes of travel, like bicycles, like walking, like public transportation, more attractive. This is key. The second aspect I want to highlight of this curve is that the impact on public health of moving to the right hand of this curve, sort of that high income, high motorization part of this curve, would be enormous. It's not even clear that if indeed incomes rose to those levels, we'd be able to manage the impact of all these automobiles. From the demand for road space and parking to the environmental fumes and the impact on active transport users. Sedentary patterns, for example, would change dramatically. To give you a sense of the importance of non-auto travel, even currently for some cities, Latin America, I turn to some research that we're just completing in Salvador. Consider these three megacities, capital cities covering broad latitudes, from Mexico City to Santiago, stopping in Bogota. And what we did is we looked at the household travel surveys in which people report basically how they travel during a regular day of the week. The first left side of this panel shows what percentage of trips are exclusively walking from door to door. And we found that it was between 25 and 40% of all the trips that people make are by walking only. Now, we expand our definition of trips to think about trips that involve multiple modes. For example, one walks to the bus, takes the bus, maybe walks a little more to take a transfer, and then take the bus to the next point where one stops and gets off and walks to a destination. Then between 45 and almost 70% of all trips involve some walking, either entirely walking or some parts of the trip had walking. And due to this, and I'm moving to the right-hand side of this curve, between this slide, between 19 and 25% of the population in these three cities meet WHO guidelines for physical activity solely from their mobility, solely from walking. I'm not including bicycling here yet, but it's pretty remarkable. Walking is critical for mobility, for physical activity, and for health. And here's where I think a major challenge emerges. Some of that walking, maybe much of that walking, is readily given away once other modes of transportation have less friction. Maybe we can afford them more. Maybe they're faster. The friction of walking is considerable. And overall, that substitution from walking to other modes may be a good thing if people's well-being, again, mental health benefits, are improving. The challenge that we have is, do we accept the sedentary patterns that ensue from substituting walking for other modes of transportation? There's also an equity dimension here. And as you'll hear in the next few slides, there may be other ways in which we might get to similar improvements without necessarily sacrificing physical activity. Now I'll focus on emerging trends because I think this is where the future of transportation is being reshaped. I'm going to focus on three of them: micromobility, the Mirage of electric vehicles, and the idea of mobility as a service. So I want to begin by defining what is micromobility. And micromobility is mobility, movement in space that is assisted by very light modes of travel. Think about bicycles, think about scooters. These were fringe modes of transportation in the past. Yet the good news globally is that there is an increased awareness of the richness of these transportation options and an openness to consider other modes. Yet we don't know much about micromobility. When these modes are introduced to one of our cities, do they take away from walking? Do they help transit for their first kilometer or their last kilometer? Do they take away from automobiles or motorcycles? Do they change physical activity? What's their safety record? These are critical urban health questions that we need to begin grappling with. The second emerging trend has to do with what I call the Mirage of EVs, electric vehicles. I'm here in California. EVs are the latest fad. They will save the world, if you ask most people. And I apologize for the pessimistic tone, but to me, EVs are largely a band-aid on the main problem. EVs remain a radically carbon-intensive mode of transportation. If you think about cradle to grave per user. I don't see a radical change in road collisions thanks to EVs. Yes, they're lighter, that's good. They're also quieter, and that's not good for pedestrians. It's good for other reasons to be quieter, particularly in noisy cities. There's concerns about physical activity, right, for users and non-users alike. Air quality improvements are not guaranteed. They're going to depend on the energy matrix. They may improve air quality if your sources of power are clean, but may not if your sources of power are not very clean, for example, carbon. The third trend that I think is dramatically impacting transportation, particularly in the medium to long term, is connected to the first one, is the concept of mobility as a service. It's the fact that certain technologies have now enabled us to share mobility assets and get the service we desire from them instead of owning them outright. Currently, think about taxi cabs, Uber, Didi. These are mobility as a service providers, but there's also some other ones like bicycle sharing or scooter sharing. And in fact, public transportation in some ways, it's mobility as a service. But coupled with vehicular automation, mobility as a service, I think, will become much more common, both for public transportation and for private vehicles. And given the density of many of our global cities, shared automated small vehicles, sedans, private vehicles, are unlikely to function well in those very dense environments. As an aside, some of my Silicon Valley colleagues have urged decision makers to stop investing in transit and reconsider reinvesting in highways across downtowns, thanks to the promise of shared automated vehicles. Imagine that. It's as if we have not learned from our past mistakes. The good news, however, is that mobility as a service with automated vehicles are likely to be highly successful in dense cities with large vehicles. Why? Because they may reduce the friction of using shared public transportation. In fact, one such automated mobility as a service that has taken root in the global south are these aerial cable cars. For those of you interested in this technology, you will be hearing results from a terrific evaluation of Bogota's system implemented a couple of years ago, I think on Wednesday morning during one of the conference panels. A very interesting evaluation that occurred. But without being too pessimistic, I also want to suggest some great opportunities. I suggest that there's a wonderful chance to retrofit the spaces that are available because of less parking, for example, to our cities. It's a wonderful opportunity for us to think about what to do with them. Perhaps provide affordable housing, well located, because affordable housing is very difficult to provide if it's well located. Think about 1.4 million spaces would open up in a city like Houston, or almost 200,000 parking spaces would open in Hong Kong. Why? Because the vehicles are not sitting idle. They'll be moving people around, possibly. Maybe it's rain gardens and biosoils to capture rainwater from those predictable increases in storm water, in storm frequency and intensity. Or maybe devote some of these to the creation of networks of bicycle lanes or sidewalks for bicycle users or for pedestrians. So we need to be able to unlock these urban spaces and retrofit them to be able to create the benefits that could happen if we are strategic about it. If we continue to provide the space for the automobile, we'll perpetuate the inequities and those impacts on health that we've been witnessing up to date. So I want to conclude by highlighting the good and the bad news. The good and bad news are that the future of transportation is being redrawn yet again. The impacts on city form and health and how these opportunities are distributed in space and for whom are yet to be determined. There are glimmers of hope, but there's also some areas of concern. And then I conclude with how I started. Urban policymakers, communities, they need support from us, researchers, practitioners, in understanding and quantifying the impacts of these emerging technologies and how they're being implemented, both to avoid the errors of the past, but also to proactively mitigate concerns and magnify their future benefits. Thank you very much.
Thank you so much, Daniel. That was fascinating. And you really brought up several critically important issues for finding ways to translate evidence into policy and for resisting that inevitability that you talk about of motorization as cities grow, and then considering opportunities for incorporating physical activity into daily life in cities, and then all those exciting new innovations and trends that we really need to find evidence around. Some of those I struggle with, and I'm so curious to learn more, especially around the micromobility piece, the electric vehicles, and the shared mobility piece. So I hope we can dig into that further during our discussion. Thank you for the great presentation. And now it's my pleasure to introduce Dr. Rachel Cooper. Dr. Cooper is a distinguished professor of design, management, and policy at Lancaster University. Her research interests include design thinking, design management, and design policy, with a specific interest in design for well-being and socially responsible design. She was a lead expert for the United Kingdom government's Foresight program on the future of cities from 2013 to 2016. and was on the UK's Academy of Medical Sciences Working Group addressing the health of the public 2040. She's currently a chair of the UK Prevention Research Partnership Expert Advisory Group and a president of the Design Research Society, among many other things. I don't have time to tell you all of them. But with that, the floor is yours, Dr. Cooper. Thank you so much for being here today. Dr. Cooper, I think you're on mute. Got it? Okay.
Yeah. Good evening, good morning, good day. It's a pleasure to be here. I'll share my screen and hopefully. Is everybody see that? Yes?
Looks great.
Great. Okay. And I've started. Okay, so we're going to start with actually the title of this was given to me in a way. So to answer this could take the whole conference, I think. And in fact, I think that's what the conference is doing. But I'm going to briefly talk about density, touch on mixed use, and touch on the pandemic and its relation to these things, and whether we should rethink urban design. So let me start with density. I noticed that Daniel spoke about density in his presentation. I'm sure density will come up everywhere, and it's a word that's been used frequently in the last 18 months. It's obviously crucial for long-term sustainability. People use it as a proxy for getting towards sustainability. However, it's a very vague term, and it's very problematic to define. It's dependent, when you talk about density, it depends on what kind of density, how it's defined and conceptualized and assessed. Often it's dwelling density or built form density is used in policy making, but that inevitably takes over other forms of density. And a few years ago, I was curious about density. So I did a review of density, and I'll come to that in a moment, but I just want you to think about what this means, what density means. We have the density of built form, the most common use of density. But that brings along density of other things which are beneficial or not very beneficial to our health. Transport and another form of density and another form of density. So looking at that, I did a review of as much of the literature I could find on density. And if we take density as the number of units in a given area, we can look at density and all sorts of natural form and how beneficial or not beneficial that is. Of course, density of built form, the most common measure of density. But there is also, with the density of built form, we have the density of mobile form, and that includes all forms of transport. But static form, waste, digital tech, everything. And then we have the number of people or the number of organizations and businesses in a place. And then in all the papers, there were different definitions of a given area in terms of space or scale. So when we talk about density, there's a lot of things we have to take into consideration. And I have to say, often papers don't do that. And of course, there's a lot of work on different interdependencies. Density in every form of other aspect of life a paper can be found on. So when you're a decision maker looking at cities, thinking about how you take into account the relationship between density and other aspects is quite a big challenge. And if we just take density in relation, the advantages and disadvantages of density and the sorts of arguments that have been made around density, you know, density is always, the advantages of density are always related to, you know, reduction of fossil fuels, enhancing accessibility, everything that Daniel was talking about. It also exacerbates traffic congestion if you have a number of cars in a particular space or parking problems. Density the advocates suggest it makes better use of resources, but it also, if it depends on what the density is, if it's all pavements, if it's houses with their front yards taken over by their lawns removed and their pavements paved over, you then have a reduced area to absorb rainfall. And then you have the whole issue of social equity and diversity. Density is seen as a contributor to improving house choice and affordability, more residences, more ability to include young people and elderly through the life course. And density, and I might say mixed use here, maybe reduces social segregation and exclusion. But the disadvantages are you lose privacy, it increases noise and nuisance, it causes all sorts of aspects of psychological stress and cognitive overload, loss of control, and all the issues which I'm sure most people attending this conference know about. And economic, the advantages of density is enabling investment in new and better amenities, but it costs more to build. And actually, it's the maintenance of high density that is a critical issue. Often things are built without thinking about the ongoing use, management, and maintenance. And even green space, you know, this whole, you know, forever we've been talking about the value of green space to the residents, and if it's dense, they need more green space. But often, if you've got more built form, you lose public green space. So it's about the careful thinking about what that density is. Now, I thought I'd do a quick review of some of the papers that have been produced over the last year in terms of COVID-19. Most of the papers have been around what's been happening in the global north, and a lot of the papers have been on the USA. But this is an early study, came out of, came in the Journal of American Planning and Association. And what I was interested in was the finding that density is not related to rates of COVID infection. And this is in various metropolitan areas in the US. And actually what was found was connectivity between counties in metropolitan areas was mattered more than county density for the pandemic strength and the pandemic spread. So in actual fact, this paper was suggesting that the more connected the places are in a large metropolitan area, the harder they are hit by the pandemic. So it wasn't just the place, it was the spread and the connectivity between the places. Another couple of papers actually said the same thing. There's no scientific consensus about density. Urban connectivity appears to play a bigger role, and so there you go. These are what has been said in the global north. Actually, I found an interesting paper in Australia. They did a study, they canvassed the opinion of planning professionals in Australia. And those planning, basically, there was a division between planners. Some felt that the whole issue of city size, urban density, public transport and open space provision and housing should be reconsidered. Others felt they shouldn't. I'd like to show you some of the drawings that actually came out of this paper. So these were the ideas that some of the respondents had. So, you know, you had immediately sort of immediate responses was reduce the height of all buildings so that they're all 3-story and people could walk up to the flats and you didn't have to rely on standing closely in lifts. Or you know, the participants noted dispersion could be achieved through larger areas divided into smaller networks with green spaces. Or they were looking at, you know, where in a city there was full lockdown, but as you got further out, you could have partial lockdown and no lockdown. So they were all thinking about the spatial qualities of and how you group people together. But I thought it was interesting that they are starting to think about that. However, The important thing that was coming out of the John Hopkins work was that most people, when they talked about COVID and density, they were really talking about crowding. And we can see this all over the world, not least in the UK, where they keep allowing us to do the crowding. We've got a football match, I think, sometime this week, and there's going to the full time, they're going to have 60,000 close together in the stadium for the European football final. So the finer points of where people gather and how they gather and the sorts of socioeconomic conditions is vital, and they are, it seems to me, the super spreader events. So if we're going to think about density, then we think about the relationship between density and connectivity and crowding. If you want to think about crowding, think about the places that are crowded. Think about the fact that the slum conditions in every 6 London residents are less. It's less dense than any place found in some of the slum conditions, particularly in India, and it was found, obviously, that in some studies that, of course, the vulnerable groups in those slum areas were hit harder than the non-slum areas. And of course, this was exacerbated by the lack of basic services. And I think we're all aware of that. And it makes it difficult for those people in slums to do any of the practices that we might be told in Europe, in the United States, about social distance, about staying at home and hand washing. And actually, if you think about the cage homes in Hong Kong, I don't know the data, but people living in really close conditions were wanting to sleep on the street, whereas in the UK we were trying to get our homeless off the street and into places that they could isolate. So, and another study looked at COVID-19 in urban neighborhoods and slums, and again, in the cities where there's high levels of slum conditions, there was high levels of COVID. So crowding is really important. Now, I'm not going to talk about mixed use because that would be another study on mixed use and COVID, but actually mixed use has this relationship with density and in term, mixed use is one of those ways of providing the aesthetically rich, the intensive communities that people get a buzz from, the buzz of a city, and also enables people, when you have mixed use with intensity, you enable people to have much more physical activity, and as Daniel said, some of these issues around choice of transport mode. However, again, lower socioeconomic status and higher density and mixed use means that we have less availability of healthy foods and higher diabetes, etc., etc. Again, I'm sure everybody knows about that. If we come back to thinking about the principles of designing the urban environment, we really have 3 factors: the design of the fabric of the physical environment, the effect of the fabric of that physical environment on the ambient environment, and the psychological impacts of that environment. And density really comes into all of those three categorizations. And we need to think about density in terms of how people access nature, air quality, etc. And I'm just going to carry on. So, we know this is a very simple diagram of everything that this conference will talk about or would know about. The environment has an effect on our quality of life. In non-communicable diseases, it affects our lifestyle and the outcomes of that lifestyle. And that is very closely related to density and how much we access good food, how much we move, a level of activity, as well as the sort of basic quality of life of the infrastructure we're living in. it also relates to crowding. So the environment and how we go places, in what form, where we spend time, and the crowding and the transmission of air affects infection transmission. So do we need to rethink urban design? No. These principles that I've put here, the ones in white, came from a book I edited on a complete reference guide on well-being in the environment. And there was an enormous amount of different guidance on how we live in cities, what we should do to cities. And you know, we should promote physical positive mood by the way we design streets with calming, traffic calming measures, providing interconnected streets, short blocks, providing buffer zones, shared space, designing neighborhood for children. And actually, when we find we design neighborhoods for children, it usually works for everybody else. Enable independence at old age, allowing people to move around, promote physical activity and healthy diet, make moving easy, facilitating designing so that we can facilitate good relationships. I noticed in the pandemic there's some work on designing apartments that all had balconies so that people could actually talk to each other. Helping people feel safe from crime, and the final one, reducing a sense of crowding, designing public space that enables people to move with ease, incorporate landmarks, wayfinding cues, trees, mailboxes, etc. in buildings and neighborhoods, design a sense of space, either horizontal and vertical. And that was really interesting because that was there prior to the pandemic. So actually reducing crowding and the sense of crowding is still very important. But before we do any of that, we've still got to address the whole issue of the quality of the fabric of the environment. So we still come back to improving the slums, the households, and those sort of conditions. So if we start at the bottom, if we take Maslow's hierarchy of needs, you know, let's start making sure that the places that we live in have those, the ones in yellow, and then let's move up in terms of what we deliver. Easy to say, design cities that are easy on the eye, green, clean, accessible, friendly, courteous, affordable, resilient, and sustainable. That's what we should do. Now, quickly, what the pandemic did in Lancaster, one slide is, the city council had all sorts of ideas of wanting to have new types of transport and mobility. And there were the placard brigades who didn't want cycle lanes, who didn't want this, that, and the other. Because the streets were empty, because people weren't going on public transport, they created mobile pop-up cycle lanes. So they created a sort of living lab in the city. And this is where I think we can build on the experience of the pandemic and enable people to experiment. And finally, we have to think about mixed neighborhoods, multiple purpose neighborhoods in a different way. So this was done by a DRM, an urban proposal around the sort of 15-minute city, but actually thinking about the richness of a city, the diverseness of a city, even when it is dense. We need to think about that. I'm going to stop there. But to say that density is not a simple measure, mixed use is not straightforward, and the challenge remains how to implement the good practice principles that we all know through urban design and redesign. And how do we improve inequity, and can the post-pandemic decisions drive forward urban design and health quicker and better? So thank you very much.
Thank you so much, Rachel. You've left us with a lot to think about there that I'm hoping we'll get into in the discussion as well. But I think especially important is breaking down the various and often complex conceptualizations of density, their interdependencies, That piece is critically important, I think, because we often see that it's used as a blanket positive or negative without much consideration of the different types of density or the different interdependencies that we're actually talking about. So that was really helpful. And I also appreciate you bringing up the fact that density has not been linked to higher COVID infections and deaths. That's definitely something that we heard a lot about in the beginning. And also, I'm heartened to hear your recommendation that we don't actually need to rethink all of urban design, but instead continue to improve connectivity, green space, walkability, mobility, social connectivity, safety, and reducing that sense of crowding in public spaces. We just maybe need to amplify it, and it's taken on an even greater importance now because of the pandemic. So thank you so much for those really great insights, and looking forward to speaking more about city design and density in our chat afterwards. So next, I am extremely pleased to introduce Dr. Thiago Eric de Sá, who it's been an absolute delight to work more closely with over the past year as part of the ISUH-WHO collaboration. He is a healthy urban environment technical officer within the environment, climate change, and health area at the World Health Organization. And he currently leads WHO work on healthy urban planning and serves as the responsible officer for the publication Integrating Health in Urban and Territorial Planning, a source book. That was jointly published with UN Habitat and launched in May 2020. One of his main areas of work includes the development of guidance and tools for identifying and addressing health impacts of transportation and land use, with most recent work including the adaptation for global use of the health and economic assessment tool for walking and cycling, the heath tool. Previously, Dr. de Sá worked as a researcher on urban health and environmental epidemiology, and he has a long track record of interesting publications in several academic journals, so go check them out. But over to you, Dr. de Sá. Thank you so much for being with us today.
Thank you, Giselle. Thank you for the excellent introduction, and Rachel, Daniel, Sotiris, all the colleagues. It's a great pleasure to be here. For those who speak Spanish or Portuguese, olá, amigas e amigos. It's a great pleasure to be speaking remotely, but from Latin America, which is a region that, needless to say, is very dear to my heart. So I hope that you can see my presentation. Excellent. Today I would like to discuss how to transform our collective urban future through built environments and urban planning. And I would like to go through that with some of the basic questions. I think that the way the plenary, the title of the plenary was framed, somehow invited me to bring back some of the basics. Of course, not attempting to answer to that comprehensively, but to remind us of some of the critical aspects that we should consider while trying to address built environments for better health. Most of my slides will be structured as you see in this version. And for those interested to dig deeper on specific aspects, I have suggested a publication on the left bottom corner. The first question I would like us to reflect on is on the whys. What is the justification for us to work on built environments? And certainly one of them is the fact that built environment, as you heard from the previous presentations, that it shapes the quality of life and the options we have or don't have in our daily living, whether that being the community, the commuting options we have, or how safe we are while crossing the street or experience the public space, or the food environment around us, which will ultimately shape the food options that we have in our daily life. It also impacts on the quality and the safety of many basic collective assets, from the space we share. And you just saw in Rachel's presentation how that can be quite complex in understanding the quality of the space we share, but also the air we breathe, the water we drink, and many other basic assets that we should take care of. Built environments also very much mediate our relationship with nature in many ways, and it influences the benefits we may or may not acquire from, for example, urban ecosystem services, such as the ones we could get from green and blue spaces. As you see in the picture, certainly those living down there are not necessarily benefiting much from the limited green space they have. But interestingly, the same would apply for those living up here, which are surrounded by the largest urban forest in the planet, but still do not have the chance to benefit fully from that proximity. Conversely, the built environments will also impact the health of the urban nature itself. Ultimately, I would say that the main justification for us to address health and well-being through built environments is because that determines the health and well-being of all living beings on this planet. Not only for this, but also for future generations. And I think that it is important whenever considering the interventions in the built environments that we account for this generational aspect as well. And the fact that not only environmental determinants will be tackled here, but certainly social and economic determinants as well. Well, the second question that I would like to bring to this discussion is the purpose. What could be the justifications for us to intervene through urban environments? Well, one of them is certainly to address and respond to those determinants of health and well-being that can be modified through the built environment. By definition, built environment are human-made inventions, and therefore they are modifiable by us. But also to enable flourishing, vibrant communities and a fulfilling life across generations. A third reason, justification why we should focus on intervening and improving built environments has to do with the situation we live today, and some of the colleagues already alluded to that. I think that this unfortunate situation pushes us to intervene in the built environment to prepare and respond to many of the concomitant global health challenges we face today. From COVID to NCDs to the mental health crisis we face, and it has been deepened because of the COVID situation, particularly among children and older persons. That is also an opportunity for us. Now, you've seen in Rachel's presentation some of innovative, quickly implemented interventions that if we manage to lock in, they could deliver health through built environments for a long time to come. And of course, another reason why we should invest in transforming built environments is to prepare and respond to another major agenda, which is climate change and the global environmental degradation. We are currently reaching the boundaries of the planet in many environmental aspects, and there's no other way to solve this issue other than tackling the built environments that again, it's on our hands. Now, I briefly mentioned some of the reasons, some of the justifications for us to focus on built environment, but also some of the objectives we could have by addressing them. The next question that I think it's important for us to highlight is, for whom are we doing this? And in addition to that, who does it? We know that the built environments that we face today, they are a result of the competing forces shaping its form and functioning. And it is fair to say that the end result is not benefiting everyone. We have many left behind here. So while changes should benefit the whole society, I would say that we should obsessively try and bridge the inequity gap here, not only in terms of the benefits, but also in terms of the active participation of everyone in the society in planning, implementing, and monitoring those interventions. And then it's easier said than done, but it's a challenge that we have to take seriously. Now, another aspect that I find crucial in this conversation is that the role and the importance of the local authorities, the policymakers, and the communities. And local knowledge is key here because it is at the local level, it is at that planning scale, at the community scale, at the local scale where policies will meet people. Of course, we have to ensure a vertical integration across the different levels of government and a horizontal integration across the different sectors and stakeholders that should be involved. But certainly, we should strengthen the role of local authorities, policymakers, and communities, because oftentimes they are under-resourced and with a very large agenda to handle. Now, most of the environment is built outside the formal planning mechanisms. And I think that we should acknowledge this instead of trying to fight against it, which is commonly what we observe in many places across the globe. We should acknowledge that force and wisely use it in our favor. We know that oftentimes cities, 90% of cities are developed outside the formal structures of planning and development. A third large audience that I truly believe, we as WHO truly believe that should be involved, and even more so, are the health professionals. Now, not only the healthcare workers, but the public health professionals and the broader health community, which we in this conference are all part of. We continue to work to ensure that the healthcare workers and the broader health community serve not only as advocates for the health enhancing solutions, but also as active participants, contributing with their knowledge, their data, and their respective voice. We have or should have a health professional in every single corner of this planet. Now, I would like to end my intervention here, briefly touching upon some of the hows, and again, the colleagues already mentioned several of them. I would like to highlight 4. The first one is for us to improve the knowledge base. We researchers, and I consider myself a researcher as well, we like to say that more research is needed, and that is true, but not any research is needed, right? We need to take stock of what we already have there and aim at improving the understanding, not only on the links between built environments and health, but also which interventions work, where do they work, where they don't work, why they don't work, and also which strategies are effective in bringing all the relevant voices to this process, the ones I just mentioned, for example. Another critical aspect to me are to have the governance mechanisms and the implementation frameworks in place that maximize local participation and local leadership. And we had the opportunity in the previous ICOH to share some of the preliminary results of the Urban Health Initiative, which is an implementation framework that is attempting to do precisely this. And I'm quite happy with what we have managed to achieve by enabling the local leadership in the pilot projects that we have at the moment. This is one example. There are many others that we could tap in. Just to give some quick notes on that, we managed, thanks to the leadership of local authorities and a large network involved in this project, to develop one of the very first health impact assessments in mainland Africa, highlighting in an integrated manner the health and economic benefits that the policies being considered would deliver, not only in terms of reductions of air pollution, but also increases in physical activity, reductions in road traffic injuries, plus the carbon emissions, all at the same time. We heard Daniel talking about the Latin American cities. Well, the experience in Accra is quite interesting because half of the trips are done by walk, and yet less than 5% of the roads have any sort of pavement for walking. A third point that I would like to highlight here is the fact that we, as this broader community, have already produced a lot of existing tools and guidance. So we do not need to reinvent the wheel. We have a lot to use already, and we can make best use of that, including, for example, the data and the analytical applications to plan and track progress. And Giselle has just highlighted one that is now taking a lot of time and energy, and we're happy with that, to take that to the global level, which is the health and economic assessment for walking and cycling. But there are many others. There are not analytical applications to help us to crunch some numbers. We know that numbers are not the end of the story. We do need to have a comprehensive health impact assessment when we look to the policies addressing the built environment. But some numbers are also important, and being able to quantify them through some of those analytical applications will enhance the business case for the right policies to be implemented. And then a final point that I would like to highlight on the house, I said 4, there were actually 5, are the alliances to be built. We should more and more be able to build the alliances that we need. And I was very happy to hear Giselle saying that one of the priorities from ISUH is to expand the network, because more than ever, perhaps we need that. And in that process, highlighting that health and well-being is not just an outcome of what we do or don't do with the built environments that we live in, but it's also a fundamental input, and it can be used throughout the process, from the diagnosis to the planning, to the implementation, and to the tracking of those interventions. I would like to just highlight one result of this alliance between the Territorial and Habitat, which you heard of already, which is we're very happy to share that today we just launched the Spanish version of the source book Integrating Health in Urban and Territorial Planning, which compiles and makes the framing for some of what I have just presented here today. And for those interested to follow up on our work around healthy urban environments, please reach out, and also join our team at WHO's networking event tomorrow at 5:30 European time. Thank you very much.
Thank you, Tiago. That was so interesting. And you brought up several excellent points about the ways that our urban environments shape our choices and options for health, including for physical activity and nutrition, and also our shared resources. And the fact that they're modifiable and that transforming built environment challenges could be the key to solving several of our greatest public health crises worldwide. So that's very powerful. But you also mentioned that large areas of cities aren't actually developed by planning professionals and are instead developed informally. So I'll be really interested in learning more about all of those aspects, but also about your suggestions for sharing existing tools and resources like the source book that you mentioned, and with those that are shaping informal communities and therefore impacting millions of urban residents when we get to our chat. So thank you for that. Well, last but not least, I am delighted to introduce Dr. Sotiris Vardoulakis. Dr. Vardoulakis is the inaugural professor of global environmental health and leader of the Environment, Climate, and Health Group at the Australian National University. He founded and co-chairs the Healthy Polis International Consortium for Urban Environmental Health and Sustainability, and his work focuses on the effects of climate change and air pollution on health, on mitigation and adaptation solutions in the built environment. So with that, take it away, Dr. Vardoulakis. Thank you so much for being with us.
Thank you very much, Giselle. Thanks, everybody. Delighted to be involved in this session. Let me try to find my slides. I've done that before, so I should be able to do it again.
Take your time.
Okay. Can you see my first slide?
It looks great.
Okay. Thanks very much. Good morning, good evening to everybody, depending on where you are. Or buenos dias, buenas tardes. It's a pleasure to be part of this session. I will discuss mainly the effects of air pollution in relation to COVID-19 and the pandemic, and also in relation to climate change mitigation and adaptation. So building on the discussion we had so far on urban form, on transport modes, on interactions between urban health and well-being and the pandemic, I will give some more insights into the specific aspects of air pollution and health and climate change and health. So just to start with an overview of where we stand at the moment in terms of the pandemic. So this thing, the update from the Johns Hopkins University. You see here the number of cases and deaths, COVID deaths globally. So we have nearly 4 million deaths at currently across the world. And you can see also the evolution of the cases and the deaths, which show some pattern of seasonality, as we can see here in the smaller window. So when we look at the deaths we had from COVID, we had around 2 million deaths in 2020. And we can compare that with the deaths attributable to ambient air pollution, which is air pollution coming from road transport, energy generation industry. And that figure was around 4.2 million deaths per year. We had another 3.8 million deaths attributable to household air pollution, and this is air pollution from biomass burning in poor households, mainly in low-income countries, sub-Saharan Africa, South Asia, Latin America as well. And we can see that the combined impact of indoor and outdoor air pollution is around 8 million deaths per year. And in addition to that, we have about 250,000 deaths attributable to climate change. So this is possibly a large underestimate. What is quantified here are deaths attributable to malnutrition, malaria, heat stress, and diarrhea. So it doesn't cover all aspects of climate change, but some of the aspects of climate change. So here we can put into perspective the different risk factors. And where I would like to focus in this presentation is the interactions between these factors. And there are several of those interactions which are interesting and give us some lessons about the evolution of the pandemic and also the evolution of climate change and air pollution globally. So first of all, there are hypotheses indicating that air pollution may worsen COVID-19 health outcomes. And this is because air pollution weakens our immune system, it damages epithelial cells in the respiratory tract, and also increases the risk of cardiovascular and respiratory disease. And all these aspects affect mortality, make us more susceptible to contracting the virus. There are a number of studies published over the last 12 months from different parts of the world associating air pollution and COVID-19 cases or COVID-19 deaths. I will present here the findings of one of the best studies. So that was the studies from the Harvard School of Public Health, published last year. And the investigators there mapped the air pollution levels, so exposure to long-term air pollution over 17 years across the US, and they also mapped COVID-19 deaths per million of population. When they associated these two aspects, PM2.5, this particular air pollution, long-term exposure, and COVID deaths, they found significant statistical associations. And these associations persisted after controlling for different confounding factors, including urban density, including the age structure of the population, number of hospital deaths, beds, income, education, etc. So it was a robust analysis. And as you can see here, when they compared the different mortality rates from COVID-19 with for different quintiles of air pollution exposure, what you can see here is that the mortality rate is higher for people who have been exposed to higher levels of particulate air pollution over a number of years. And they found that even 1 micron per meter cube increase in PM2.5 was associated with about 8% increase in the rate of death from COVID-19. So a significant association. Now I will move on to discuss the opposite side of the coin, and this is how COVID-19 restrictions and lockdowns affect air quality. And there was a lot of anecdotal evidence in social media about air quality improving during the lockdown. So there are images of the Himalayas seen from Punjab in India, empty streets in Yuan, and clear skies in Los Angeles during the first phase of the lockdowns. And that was mainly due to the reductions in road traffic, but also in reductions in industrial production and the power generation. Now, when we look at satellite images here, you can see a big chunk of Europe, and this map shows you nitrogen dioxide levels across Europe. So nitrogen dioxide is a pollutant that comes mainly from road traffic and power generation. These concentrations here were in 2019, so March to April, and then we see a similar map the year of the pandemic. So this is March to April 2020. And as you can see, there was a very significant reduction in PM2.5, in nitrogen dioxide levels. This reduction was around 50% in the most polluted cities in Europe, like in Paris, Madrid, Milan, Rome. And that, of course, that was mainly due to the reduction in road transport. Similar kind of reductions in nitrogen dioxide were observed in China, again, satellite images before and after the lockdown. So this in January. I would remind you that the lockdown in China happened earlier than in most parts of the world. And you can see here that in February, NO2 levels were much lower. So that's an unintended consequence and a positive aspect of the lockdowns, a global natural experiment indicating that we can actually substantially reduce road traffic related air pollution if we modify our way of living and our patterns of mobility. Now, I will move on to show you some data from the place where I'm based at, from Canberra here in Australia, the capital of Australia, close to the eastern coast. And now I'll show you concentrations of fine particles, PM2.5. And you see here a series of years. And what you can observe is that we had a much higher concentration in 2019, 2020 of PM2.5 concentrations. This had nothing to do with the pandemic. It was related to the bushfires we experienced in Eastern Australia, unprecedented bushfires affecting air quality for several weeks. And as you can see here, we have the worst air quality in the world on the 7th of January 2020, and that is in Canberra, in a city which usually enjoys good air quality. Now, when we look at daily levels of PM2.5, what you can see here on this graph is the very high levels during the bushfires in summer in Australia, concentrations reaching 800 micrometer cube, exceeding by far the air quality standards. But we also see some high concentrations in this part of the graph, which is around winter 2020, and that was related to wood heaters. So what happened is that as people work more increasingly from home, they used wood heaters to warm their houses, and that created a lot of air pollution in Canberra. So we typically have high levels of smoke in winter due to wood heaters, but last year was exceptionally high. If I blow up this part of the graph here, this in winter in Canberra, you see again this graph. You can see the exceedances, and you can see the effect of wood heaters. So this is, in this case, so we have a different, the opposite effect that we had with nitrogen dioxide, with traffic-related air pollution. So domestically generated air pollution from wood heaters in parts of the world where people stayed at home, worked from home during winter time, increased over the period of the pandemic. Now let's see what happened with greenhouse gas emissions, carbon dioxide. So this gives us some historic perspective of emissions of carbon dioxide over the last 30 years. And what we can see here is that we have a continuous increase in carbon dioxide emissions. There are a few glitches here, financial crisis, but overall we had nearly constant increase in carbon dioxide emissions. Well, that was not the case last year. So for probably the first time in recent history, we had a global decrease in carbon dioxide, which was around between 6 and 7%. A substantial and significant decrease in carbon dioxide. Let's see how that was distributed in different sectors. So we see that the reductions were mainly related to reduction emissions from surface transport and aviation. So these emissions went down a cliff. We had some reductions in industry, industrial emissions, power generation emissions, and from public buildings. But again, we can see here an increase, a small increase in residential emissions. Again, the same effect of people staying at home, working from home, and consuming more domestic energy. When we look at the evolution of these emissions during the pandemic, during the lockdowns, we see that there was a very substantial reduction in emissions. You see here the purple curve is from China, and we see the other parts of the world, the emissions reductions during the lockdowns. But we also see here in China a rebound effect, and the same happened in most parts of the world. So these reductions in emissions were relatively short-lived. After the first phase of the pandemic, traffic went back to pre-COVID levels in many cities, and emissions went back to pre-COVID levels, and that includes carbon dioxide. So the lesson from this graph is eventually what happens is that when we have spontaneous kind of reductions in emissions, these are not long-lived. So what we need to have is structural reductions in emissions, which will provide consistent long-term benefits in terms of climate change mitigation and air quality improvements. And this is what we see here. This is the historic perspective, again, of carbon dioxide levels, carbon dioxide emissions. And you can see that there were small reductions during the oil crisis, the dissolution of the Soviet Union, the financial crisis, but always there has been a rebound effect. And this is what we're experiencing now with the pandemic. So what is absolutely fundamental in cities and globally is to have structural, technological, and also legislational changes which will provide these long-term reductions in air pollution emissions and greenhouse gas emissions. And this can be done in different sectors, with the transport sector, as Daniel explained earlier. Active travel obviously is the preferred option because of the co-benefits for health in terms of physical activity, of reduction emissions, and many direct health benefits for cardiovascular health and mental health, etc. The electrification of the vehicle fleet is obviously an important aspect of the reduction that will provide reduction in emissions in urban areas. Diet is an important area of intervention. So healthier diets, richer in fruits and vegetables with less saturated fat, less meat products, reduce emissions from the farming and agricultural sector, and improve health directly, cardiovascular health, and reduce obesity. Solar, renewable energy, solar panels, this is again an intervention that will reduce these domestic emissions that we saw earlier due to people working from home. And of course, solar energy will reduce daytime emissions from wood heaters or other non-renewable energy sources. and urban greening and more efficient health services and public health services will reduce health impacts and improve health and also contribute to the reductions in emissions from the health sector. So there is a range of urban interventions which will provide reductions in air pollution emissions, reductions in greenhouse gas emissions, and direct benefits to health. And with this slide, I will draw some conclusions from this presentation. There is early evidence suggesting that exposure to air pollution increases mortality, increased COVID mortality, and this is what we call the syndemic. So we have the impact of COVID-19 and all, which is exacerbated by the impact of air pollution. Now, lockdowns, we saw that lockdowns improve air quality in cities around the world, but not everywhere and not for every pollutant. We had large reduction in carbon dioxide emissions, mainly from transport, but also a rebound effect after the end of the more intense phase of the lockdowns. And that gives us the lesson that behavioral adjustment, the transport sector or in other sectors, and spontaneous reactions to a crisis are not enough to bring about sustainable long-term changes in emissions. And what we need really is a shift, a global shift from energy production away from fossil fuels, and a decarbonization of the economy, of the transport of industry, to bring about health benefits as well as environmental and societal benefits, and now into the future. Thank you very much for your attention, and I look forward to the panel discussion.
Thank you so much, Sotiris, for those fascinating insights into how air pollution levels changed during and after the pandemic, during other climate-related episodes like unprecedented bushfires that you mentioned and household activities like wood burning, and for describing the importance of having technological and policy changes to provide long-term reductions in greenhouse gas emissions and air pollution through a variety of built environment interventions that impact physical activity, nutrition especially, and others. Really insightful presentations. I want to thank our entire panel. You've really brought up some excellent points, and we have about 15 minutes or so left to have a great discussion about it. I've seen some good questions come in on the Q&A, so we can start with those, although I'm dying to ask some questions of my own. But I might start with the question that actually most recently came in from Mark, because it's a question to everyone. So let's start with that, and feel free to jump in, anyone who would like, and then we can get to some of the others that were a little bit more specific. So Mark brought up, are some of these new urban models like the Barcelona Superblocks project, the Paris 15-minute city, the Hamburg car-free city, or the London low-traffic neighborhoods, are those types of solutions and models possible solutions to some of the problems that have been presented in the session? So did they address density or reduce air pollution or address some of the transport issues, et cetera? So does anyone want to jump in on that question?
I can give it a go. I think there are examples of good practice from many urban areas, like the one the colleague mentioned in the chat, and I think there's a lot to be learned from these examples. Many of those examples will address transport-related impacts on air quality, on noise, on livability of cities, and other interventions relate more to the green infrastructure in cities, or urban design, or pedestrianization of urban areas. I think I will reiterate what I said conclude my presentation, that what we need really is system-based interventions, holistic interventions, which are structural and which can provide long-term benefits to health and to the environment in the context of the pandemic. And of course, another aspect which we may want to touch on is the importance of the indoor environment and the built environment in terms of the transmission of COVID-19. and the importance of ventilation and hygiene in indoor spaces. So I think we need to think very carefully about the design of the built environment and indoor spaces to minimize the risk of transmission of COVID-19 and also to improve indoor air quality and thermal comfort.
Thanks, Sotiris. Anyone else want to jump in on that or comment on what Sotiris mentioned as well?
If I may add very quickly, Giselle, I think that yes, absolutely. And for some of them, including the Superídeas in Barcelona, there's even a good chunk of evidence, thanks to IS Global, on the health benefits that we could achieve. I would just caution and also make reference to my presentation that we should be vigilant and careful on who benefits from those interventions, because oftentimes we see amazing interventions, gentrifying places, and then those benefiting are not necessarily the original citizens, and oftentimes you have a displacement. So yes, some people will benefit, but not necessarily everyone.
Great points. Rachel, please.
Yes, I think you need innovation and you need experiments, because working with either local authorities or investors, they always want proof. And sometimes you need to experiment to actually assess. So yes, because you need to do that. And then you need to also think about, as Sotiris says, the system-based interventions. So many local authorities do not move beyond silos. So the planning department doesn't talk to the transport department, doesn't talk to the education or the health department. And I'm actually doing some work with a local authority to try and help them do some of that systems thinking, because it's very hard. So if you combine innovation, experiments with some systems thinking and some impact, you might do it. So we need another approach to intervening, realizing what Tiago said about previously it's been done, and it's been done. In fact, it just disbenefits those people it was wanting to benefit in the first place. And in most cases that has been done. So there's all sorts of behavioral stuff you need to look at as well, and the markets and the money. So it is a systems-based thinking approach we need to think about.
No, excellent points. Daniel, did you want to add anything to that?
Yeah, I wanted to emphasize the fact that I would love to describe these interventions just how Rachel and Sotiris described them as system interventions, because they're very positive, right? But the risk is that as other cities look at these successes, that they think in a very reductionist way, and they leave aside all the other complementary system-wide supports that made them successful. So if, for example, just to provide a simple suggestion, if other options of travel are not palatable and we slow down streets or we prohibit traffic, what's going to happen is simply we're displacing that traffic elsewhere, and as a result, impacting gravely the walkers in those areas, those that cannot afford the vehicle, and we're creating these other hotspots of pollution. And so we're displacing the problem and not really addressing the underlying issue.
Yeah. Well, that actually leads me to one of the questions that I wanted to ask you all. You've all brought up these fascinating systems. Really, they're all systems approaches for shaping urban environments to improve health, whether it's through transforming transportation or reducing overcrowding, or gathering and sharing tools and solutions, or reducing air pollution and climate change impacts. So I wanted to just ask you all if any of you have thoughts on, what would you say are some of the best opportunities for actually building those alliances between some of the silos that Rachel mentioned, whether it's within city government, getting some of these tools into the hands of policymakers or practitioners, or even local leaders, in the case that the stakeholders that are largely the ones that are changing the built form of cities. Are there ways that you've seen to effectively actually translate these lessons that we've brought up with a systems approach into action?
Well, I would advocate, I'm a designer, so I would advocate design, but actually in new approaches to policy making and planning. So using In the UK, we have the Policy Lab, where they use designers to help policymakers make decisions. And again, we're doing that at a local level. So designing policy, and when you design something, you have to bring all the different interdependencies together. So I think actually there are tools that we could start to look at that overcome that, or try to overcome that. I have to say there's one thing. Somebody asked something about research. There was a question about, Tiago said there's lots of tools and guidelines around. And somebody said, how does the, researchers do it? And I think there is one area and that I'm struggling with at the moment. And that is when you design the future, when you design an intervention and you're looking at the multiple interdependencies, how do you value that future? Now that comes back to Daniel's point about it's different value systems in different contexts. If you have a city or a region or a local authority, you have some values about improving health, improving air quality, whatever. They can have those values, but if you have investors coming along and you have to quantify these things that you're putting in place going forward, the designs going forward, not retrospectively, not evaluating the impact of something, but actually saying, if we build an ecosystem in this place, if we reduce cars, if we do X, what are the actual future thinking? So I think actually enable people to have tools to think about how something will change something in the future by that and the multiple interdependencies would be great. So if somebody's doing that, please, it's a really good idea.
No, those are excellent points. Tiago, I thought you might want to comment, and also it is related to the question that Aina Roca brought up in the chat, which was, considering that there really is already so much out there, so many guidelines that already exist from the researcher perspective, what do you think is the best way that we can make sure that our research is noticed and used to avoid redundancy and repetition? And I think it sort of gets at that question I was asking as well. How do you actually utilize it to translate it into impact to actually transform the physical city on the ground?
Exactly. No, thanks, Giselle and Ayn as well. Maybe I'll just comment quickly on the previous question. I think that I'm fully with Rachel. I think that planning, design, but also public health are excellent entry points. But at the same time, we should have a pragmatic approach. Oftentimes, the governance structure that you have in place is a resilience office or a integration, whatever. You see, you take the best mechanism that you have in place on the grounds that people are comfortable with to implement the changes in a systemic way. And it is true, we have to do that systemically also because cities cannot afford to tackle them one by one, even though oftentimes they do insist in that approach. Specifically and then just another comment, Rachel, this is precisely what we've been trying to do together with local stakeholders and to quantify and assess their policy scenarios, and we're very happy to see the results materializing, not only in terms of the results being produced, but also in the way that those results have already started to influence the policies, which is an excellent outcome for us. On the research, Aina, being a researcher myself, I would say that the very basic there to start with is to try and answer questions that for which we still need some evidence, because oftentimes we have people answering the same questions, the low-hanging fruits, and some questions for which we don't have a good answer, such as which are the best delivery mechanisms for all this guidance that we have available to hit the ground effectively, for all these tools to be institutionalized. We know way less on that than on many other aspects related to the built environment. And then, of course, it's to work together with these people, the ones that you see using, benefiting, opposing the results that you find. So do a bit of a stakeholder mapping in advance. And I would say, even if you have the lab, the bandwidth, try and go as far as co-producing the research with them from the onset, starting with the research question.
Excellent points, Tiago. I see that we just have a couple more minutes, and I have two more questions that I want to get to that came from the audience here. So just very quickly, Daniel, I wanted to ask you, Leticia de Oliveira Cardoso asked about micromobility and a little bit more about accidents and health consequences related to micromobility, if you have a couple thoughts on that.
Yeah, thank you, Giselle, and thanks, Leticia, for the question. So some of the evidence focuses on the user, but I don't want to overplay that. So lack of protected equipment or the emergency room data suggests that experience plays a big role. Most of the admittees are very novel users, but I want to bring again the systems view, right? The safe systems to think about road safety, and it's the quality of the infrastructure, both the vehicles. In some cases, the scooters, the wheels are too small, the chassis are inappropriate, and the roads themselves that don't interact well with the vehicles. So the concerns here are differential speeds and masses to be on regular streets with automobiles and buses, for example, and also the sidewalk. We don't want them to be with pedestrians because of those differential speeds. So thinking about an intermediate space, I think some cities are innovating and thinking about bicycle lanes. And another argument in favor of providing separated spaces for these intermediate modes that are not too fast, not too slow, but that deserve that extra space. So if possible, lumping them together and providing an infrastructure that is supportive is probably a good strategy forward for safety.
Mm-hmm. Thank you so much, Daniel. So I know we're just about at time. There was a great question that came in at the end around thinking about the public health impacts at COP26. I think we can expand that to think about, all the big global commitments that we're making. How can we insert public health into the conversation? How can we really put health into the radar of countries' commitments and make sure that they're focusing on that? As we know, when we improve health, we improve so many other things, and vice versa. So I think it's really critically important that we all think about ways to improve health and put that into the conversation. And so with that, I know we didn't get a chance to answer that question, but I hope that after this session, we can all kind of take with us and consider the ways that we are impacting our built environments, transforming our built environments, our cities, small, large, growing. How is it that we actually can consider health in the conversation? And for those of you who are not necessarily health practitioners, how can you in your everyday work and life, how do you consider and think about the impacts that you're having on health? So I hope that you'll take that with you for the rest of the conference. Again, I want to thank our panelists. Thank you so much for your time and for your insights today, and for everyone who joined us today and asked great questions. We'll see you this afternoon and across the rest of the week. So thank you again so much.
Thank you.
Take
Thank you
care.
very much.
Pleasure.
Thank you. Obrigado. Gracias. Ciao.
Thank you.